Get to the latest news now. New York's single-day death toll fell below 500 for a fourth straight day. But the more telling numbers might be the preliminary results from the state's first antibody study. Found nearly 14% of the participants tested positive for antibodies. While that could mean significantly more coronavirus cases, it also suggests the state's mortality rate could be lower than previously thought. We also learned today that less than a month after its arrival, the USNS Comfort's mission is nearly finished. The Navy hospital ship will leave New York as soon as its remaining patients are discharged. News 4's Ray Villeda kicking off tonight's team coverage live outside another New York field hospital. That's the Samaritan's Purse Emergency Facility in Central Park. Ray.
Hey, Stefan, this Central Park hospital saw 38 patients today. It's still open. Hospitalizations are down across the city. But as you mentioned, new numbers, a new study based on recent antibody testing shows as many as 1 in every 5 New Yorkers may have already had coronavirus.
The streets of New York busier than they've been in weeks, while the city's emergency rooms are seeing a slowdown.
Typically on this time, on this day, all of these bays will be full.
Dr. Kedra Jackson walking us around the emergency room at Mount Sinai Morningside. The hospital provided this video.
The volume is definitely down. It's going down. However, the patients are sick, meaning to have more interventions immediately.
The mayor acknowledging hospitalizations are down, but cautioning New Yorkers not to let up on social distancing. He, too, noticing more traffic.
If it's folks starting to get a little too loose, that's a problem.
While the numbers show some of the picture, a new study shows more New Yorkers may have had the virus than reflected in hospital rooms. The governor said nearly 14% of 3,000 residents randomly tested have COVID-19 antibodies, meaning they've had the virus. That means with nearly 20 million people in the state, some 2.7 million may have already been infected.
They had the virus, they developed the antibodies, and they are now, quote unquote, recovered.
As the state ramps up testing, it's also easing some rules. Work on this Upper West Side high-rise is allowed because it includes affordable housing, considered essential.
There may be some cases where people see something, they think it's non-essential, but it actually does fit the standards for what essential is.
Perhaps a positive indicator that the cases are slowing down, the USNS Comfort is expected to leave soon. The naval ship cared for 180 patients, some still on a ventilator.
The numbers, okay, somebody is paying attention to that. We only care about the patient in front of us. We have made a difference.
Healthcare workers still making a difference. As the cases start to decrease, the nation's top health experts warning COVID-19 isn't history yet.
We will have coronavirus in the fall. I am convinced of that.
Now, just to give you some perspective on how far we've come, back in late March, the city was seeing as many as 850 cases a day. That number down to 227 yesterday. The mayor says we can't let off of social distancing. We need to keep it up to keep those numbers going down. There's no timeline yet as to when the city and the state will reopen. We're live in East Harlem tonight. I'm Ray Villeda, News 4 New York.